Thank you so much for being here. We're going to give 1 to 2 minutes to just let people roll in, but thank you so much for your patience. We'll be getting started shortly. Welcome in for all of those who are just joining. We are going to get started here shortly in about 1 minute. We're just going to wait for a few more folks to roll in. Thank you so much for your patience, and we will get started soon. Hello, Natalia. So good to see you. Thank you for being here and joining us. All right, you guys. I'm going to go ahead and get us kicked off. Thank you so much for joining us today for Resistance to Readiness. We are overcoming barriers in RBQM and quality by design. For those of you who don't know me, my name is Sarah Benson, and I'll be your host along someone I'm absolutely thrilled to introduce. If you don't know her, her name is Melisa Williamson. Her career has spanned organizations like Day One Biopharma, Abiona, Daiichi Sankyo, and Farm Olam, which is now Alucent. And now she's bringing all of that experience to her new role as a newly appointed Director of Quality Assurance at Farpoint Research. If you spent any time in the RBQM or quality space, you know that Melisa is a true powerhouse and a wealth of information. She spent over 14 years in clinical research, leading the charge in GCP and inspection readiness, building strong, proactive quality teams. Melisa is as passionate as she is knowledgeable, and she has a true gift for turning complex quality challenges into practical, people-centered solutions. Today, we're going to dig into the realities of resistance, why teams hesitate, where barriers show up, and how you can turn resistance into readiness through RBQM and quality by design. You can expect a free-flowing conversation, some real-world stories, and plenty of practical insights that you can take back to your teams. So we're going to dive in. Jackie, we can go ahead and hit that first polling question for our audience. And Melisa, I would love to ask you, what is the most common roadblock you've seen when organizations try to adopt RBQM, and how do you overcome it?
Well, first of all, thank you for that lovely introduction, Sarah. Great working with you. So the first thing I would have to say is just, this is a paradigm shift. This is sort of a difference in moving from a detection model where we're looking at the end result, the end of our systems. We're looking at deviations, quality events, queries, and we're taking care of those. We're fighting those. And I would call that firefighting. And this is a shift to say, proactively look at all of the pressures on our system being our protocol, the people involved, the technology involved, the vendors involved, take it all in the beginning and really work out a preventative model. So it's a huge shift in thinking. In our industry, we tend to sort of have a reward system in place for firefighters, for people who are constantly in the weeds. And those are our heroes that we hold up when we say they're doing a great job. I mean, everybody in our industry is a hero, but when we're looking at moving to a proactive, risk-based quality management method and philosophy, really, it's a change in philosophy. It's a paradigm shift. So it's no surprise that you're going to have a struggle to get everybody on the same page and moved over to that. We have, like I said, those systems already in place that are rewarding the current detection model. So it's a matter of being in it, but really like selling the the benefits of that prevention method. And so that's something that I think is embedded in quality, but I don't know that we really utilize the deep knowledge, as Deming would put it, on the clinical research process, the long-term process.
Thank you so much for that, Melissa. So in terms of all of this processing, why is cultural resistance often harder to tackle than technical or regulatory challenges?
Yeah, it is a little bit different. I think a couple reasons. First, I think there are when we let's say adopt a new quality management system, we already are thinking we're going to do training. We've got to train all the users. We've got to bring people in. Got to sell them on this new system. What's the benefit? It's almost like we do think in terms of change management when we're doing that. But if we are talking about this change from detection to prevention, we're not necessarily thinking of it in the same terms. And I think that we should. So, for example, really putting on our change management hat and saying, let's integrate quality by design into our existing processes so that we're not causing a whole bunch of resistance. And teams that are so used to working on their current process, they're not going to, if you're not communicating, you're not giving them awareness and training and the tools, they're really not going to be prepared to succeed. So it's almost setting teams up for failure if you're not integrating those already into your workflows. And I think that another piece of that is having executive sponsorship. So getting right up front before we start implementing things and throwing tools out and changing everything, really getting the buy-in at the top of your organization so that when the resistance comes, you have steam valves. You can let people talk about it, and you don't have, maybe an executive who's going to say, well, it's not working and let's change direction. So you really want to make sure you have buy-in from the top, and that you have a workforce who is prepared, and that you have also a lot of empathy with them. It's a change, and really treating it with change management tools is, I think, essential. For sure.
Absolutely. Thank you, Melissa. Jackie, we can go ahead and hit that second polling question if you don't mind. And then I would love to, as we get those questions and answers rolling in, ask you, Melissa, what strategies seem to work best to secure and sustain leadership buy-in for RBQM?
Great question. So I think for me, and I've thought about this a lot, like how do you just come in and start now? Because that's what I want to say, start now, right? But so I talked about engaging your leadership and creating champions at the leadership level in all of your departments and making sure that people really understand what you're doing. But one thing that you can do is go ahead and start small. So pilot a quality by design program in your next revision. That doesn't seem very small. Or start it if you have multiple protocols in one protocol. Start small with a small task force, a small team that is cross-functional, that has all the elements that you're going to need for your risk assessment, but show that it works in one, let's say, protocol. And then that's a way that you can really gain buy-in and build momentum over time. And people will see the outcomes, and they'll see that this is actually a reduced stress for me, right? So maybe it's a little more work up front, but now I have those downstream benefits that are really going to impact the cost and the data, everything.
Yeah, and speaking of costs and data, what ROI arguments have been most persuasive when convincing leadership to invest in RBQM?
So I want to immediately just say you're going to avoid cost from early risk detection. You'll have, let's say, reduced amendments related to your critical quality factors, lower monitoring costs. But before all that, I want to say a huge factor, and especially in our industry, we're in an industry to help people. So I think it does resonate with your leadership to say, consider the people, consider the patient experience, making a schedule of activities that's less complicated for your monitors, your CRAs, for your study coordinators, for your PIs, making things easier to be compliant, easier to get the work done, and make it more manageable. And you're going to impact the outcomes But I would, and so you will lower costs and you will be more effective, but your patient's also going to have a better experience.
Yeah, absolutely. Melissa, I want to take this conversation into the word risk. Whenever teams hear the word risk, if they're new to it, they become afraid, begin to not want to really dig into it. So, how can you simplify for teams RBQM training and language so it resonates across functions?
Um, this is a great point. So, if you just want to simplify quality by design, you can say, start with the end in mind. You can say it's the absence of errors that matter, right? But I found interesting in looking at, Citi has some case studies of how quality by design was implemented. And in one of those case studies, I believe it was Oxford, they're talking about, how did they implement quality by design and how did they bring it from simply, it's almost like this new concept. And what they identified is you're going to get less resistance if you don't call it new, right? So if you don't come up with new jargon, and we've all got to relearn all of these things. So what they did is really just use the language of their community and what they already had, and then they applied quality by design tools and methods.
Yeah.
But by just not calling it out, they also didn't meet as much resistance. So their takeaway was like literally, you don't have to beat people over the head with this is a brand new thing. I think the other piece that is always so present to me is that we're doing risk management all the time in our daily lives. We're deciding if it's okay to speed, if there are any cops around. We're deciding just, risk factors in our everyday life. So I think people are actually really good at it. You give them the right tools and you give them a framework that works, and you're going to have adoption. But I think we have to sort of step back and say what's good for my specific company or my specific project, and the people in there. Really consider the people aspect.
Sure. No, fantastic. Thank you so much for that. In terms of building champions to help drive peer-to-peer adoption, do you have any sort of thoughts or feelings on that?
100%. So I think that it's super important to create champions. I think at the leadership level, but you're also going to need champions all across your systems, and that means and by systems I really just mean your processes, your vendors, your different functional groups. This is so cross-functional. You really need, I would say, maybe you need a task force, right? And you're starting to pull in those people who are going to be your experts in their field, in their areas. So, and really give them those tools to understand fully. So there's a lot of resources out there on quality by design. I would say use those to tailor to your company and your projects, and then show those people that you've identified, let's call them like stakeholders, show them how it's going to make their work easier. Give them the why, give them the motivation and the desire. And then once they have that, and once they can see the mission and the larger vision, then give them the knowledge, give them the training, give them the support. I already mentioned it, but I think empathy goes a long way. Understand the position that they're in, trying to pivot. When you've always done things a certain way and it's worked for you, maybe it's not perfect, but it's worked, you have sort of a loyalty to that. So it will take change management. It will take reinforcement. It's going to take celebrating people's successes, celebrating that an issue didn't occur or that it didn't escalate, or that it didn't have to get escalated before it was resolved. Celebrating things like that rather than celebrating these 20 errors, and now we have somebody who's brought in just to deal with that, and aren't they the hero? Really think about long-term celebrating and sharing the lessons learned, and celebrating the impact of quality by design after you've started to implement it.
Oh yeah, absolutely. Celebrating the big ones is so important.
Yeah.
Speaking of our champions, near and far, we're talking about motivating sites and CRAs to engage with RBQM when it often can feel like extra work. Do you have any sort of suggestions in making sure that your regulations and protocols are being translated in that kind of way?
Yeah, just talking to a lot of CRAs in the industry and a lot of people in the industry. Um, I had this discussion with some other quality leaders about what's the right amount of source data verification, right? And if we're not doing 100%, then what's okay, you know? And getting into that conversation, what we realized is no matter what we say, your CRAs, or at least, a long-term CRA, is probably going to do 100% SDV, even if you say it's not necessary. And the reason is because we have a culture of blame. So you have to take away that culture of blame, of fear. Deming said, drive out fear, make it okay to make mistakes. When you're doing 100%, and what does that mean? Like when you're doing 100% source data verification, what does it do for us? So if it were something that completely kept us from having errors, then we wouldn't see any errors right now, right? Because everybody's been doing it. So you have to sort of make the case for it. Sure. And that you could say, yes, do X, Y, and Z. But if a person knows, even if I do that, I'm going to get blamed. I'm going to be the one on the call who's going to say, how could you possibly miss this?
Yeah.
Then you're really doing yourself a disservice. You're moving a couple steps backwards. So
Mhm.
addressing the culture around why we currently do 100% STD and things like that. And then
Yeah.
after that, I think, it's always the motivation first, and then give them the tools, the understanding, the training, and continuously communicate. You're celebrating people who are, you need to celebrate people who are early adopters and
Mhm.
champions for quality by design. My guess is CRAs has probably been waiting for this for a long time, thinking, oh, this protocol really doesn't make sense. I don't really understand how I'm supposed to implement it, or things like that. And so make it a two-way street that you can communicate, and it's not always the sponsor communicating down to the people who are at the sites and actually looking at the data and things like that.
Fantastic. Melissa, thank you so much. I want to kind of transition our conversation into exactly that, talking about quality by design, a huge point of conversation in this line of work right now. Jackie, we can go ahead and hit that third polling question. So my question for you is, for organizations who are new to quality by design, maybe they haven't had to implement this into their protocols yet. What is the simplest way to define it so teams don't get lost in the regulatory jargon like we discussed?
Yeah, it could be easy to do. So you're hearing this buzzword or buzz phrase, quality by design. It really just means the absence of errors that matter. So you have to ask yourself what matters, right? And be very, very clear about what matters. You can also phrase it like beginning with the end in mind, starting with the finish line in mind, whatever motto you can come up with. I found a lot that rhyme lately. Um, yeah, just it's pretty simple. You're really the total concept, the philosophy is just that you are starting with all of the endpoints in mind. For example, when we're ready for an inspector to come on site and actually interview us, as quality, we'll typically pull out the compliance program. That's the program that regulatory authority was trained on. So they literally will give it to you. So at that point, pulling that out and saying, these are the questions they're going to ask you, is not the perfect time, right? It seems like it's just in time and you're going to be fresh and everything, and that's great. But let's start all the way at the beginning. Why aren't we pulling that out in the first place and saying, these are the things you're going to have to prepare to be asked throughout the entire study and things like that? That's just an example, but really moving the things that we do at the end. For example, trending, looking at what those issues are. We have very different protocols, very different complexities, totally different factors, but there's a ton of data out there, and we can mine that data and find out what worked for other companies, what didn't work, what challenges happened and didn't happen, and learn from those before in the development phase of our next protocol.
Yeah. Yeah. Amazing. Thank you so much. So let me ask you, if you were starting quality by design from scratch, what were the first 3 steps you would take as an organization?
Oh, 3 steps. This is going to be hard. I think the first thing is education. So
Yeah.
get very educated about what does it mean. There are, like I said, a lot of resources out there, a lot of information. I would even go back to Q9 risk management is a great resource of just laying out what does that mean really in general. But then take a look at your processes, because you don't want to implement something and say it's brand new when people are going to say, I think we use a tool just like that. So take it sort of an inventory of what you're using now. Do you have a risk management SOP? Do you have some tools in place already? Do you have a rack log? Do you have something that is that you're considering risk? And then talk about, can we improve it, or does it work for us? Because you don't want to you want to try to limit the amount of change that you have associated essentially to quality by design. I really feel like at some point most companies are going to want to bring in somebody who's an expert, either to train their team or to get them all on board. Or I think another piece that is really helpful is to have someone come in and really facilitate that first risk assessment, because it's a difficult process. It requires a lot of letting everyone speak. There's a lot of it could essentially, you could get into a point where it's like group think. There's a lot of issues pitfalls you can kind of get into. So bringing somebody on who can really just clarify for you, that very well could be somebody that's a part of your quality team or another team who has some risk management expertise for sure.
Fantastic. Thank you so much. Jackie, go ahead and hit that fourth polling question for us. While I ask Melissa, what roles and functions must be present at the table from the very beginning to avoid siloed implementation?
Great question. So I want to say there's sort of different groups. There's a leadership groups. So people who have the authority, the perspective, they are the people who say, who will give or take away resources for different projects. Those people who have the authority over that, I'm going to call them like functional leaders. And then you're looking at all of the functional heads that you have available. And then, and really you can work backwards from what the needs are. So patient safety, the data integrity, the actual quality of the documentation, things like that. So you want to have ClinOps, DM, QA. You want to have all of your groups, your medical monitor, the people in the room who are going to have to foster this protocol over time. And I think that'll be pretty unique. And I would call that group like your leadership group, right? But I think you also really need your connecting people. So your people who connect information, they're the communicators. Maybe they're influential, but they're not necessarily the leader of the group.
Yeah.
And then you need also, I think, your external people, what we might consider external, really. Okay, so this is an interesting thought process. So if we think of, our internal people are our sponsor people or whatever, maybe our connector people are like our CRAs, our coordinators. And then for some reason, we'll probably think of our patient as like an external stakeholder, but really they're our ultimate customer, right? Our PIs are our ultimate customer. They're really going to execute it. They're going to have intimate knowledge of what the experience is going to be like. Your nurses are going to have real experience of what that process looks like on the ground and can really help you out identifying where the risks are. I know it's always hard. We're always really pressed for time, but consider if you want to spend time now and actually go through the risk assessment and get out to and maybe save time on the back end when you can actually mitigate issues that would bubble up and become huge messes that become time sinks essentially.
Yeah, absolutely. Thank you so much. My next question for you, how do you effectively identify and prioritize critical quality factors early in trial planning?
So this is the meat of quality by design right now for our industry. I say probably start with a clean slate mindset. So don't worry too much about what we collected before, how we did it before. When you take your protocol, the question that you really need to start with is what is our goal? What matters about that goal? What would prevent us from meeting that goal? And that kind of thinking you can document on a RACT tool, RICT. There's, you're going to document eventually in your risk plan. You may work it into other plans. Everybody's going to be so creative about where they put this information. But you want to do it systematically. It is, like I said, it can be a challenging process, but it is the thinking that you're actually doing throughout the protocol development process. But this is a more systematic, line by line, going through each risk. And then I think that something that's super important is to remember that you're going to continue to do this. So as we begin implementing a study, as we start to execute, we're going to start to see things a little bit differently. And it's completely valid to go back to your critical quality factors or your tolerance limits and say, I don't think it's going to work for this. Yeah. Or I think that we can improve it, and make that normal. Make it such a normal thing to say, I think we need to go back and really reconsider this. So I would say starting and identifying, you want to pick your tool wisely, something that's fit for your purposes. If you're doing something less complex, you're going to look at a less complex perhaps tool and methodology.
Absolutely. And that brings us to our fifth polling question. So Melissa, what tools and templates, technologies make quality by design easier to adopt and sustain long term?
Great question. So I had a chance to see a lot of examples of this recently. So I think there are some free tools out there that are just excellent. So Transcelerate, I'm sure, hopefully people on this call and in the quality community and the operational community are familiar with Transcelerate. But they've made a really good RACT tool. I think they have a risk plan as well that you can take a look at their template. They have a QTL library. So you can, if you're not sure what is a QTL or what's some examples or specifically on blinding, what would that look like? You can go and look at those as well. Citi has a toolkit as well. Like I mentioned, the case studies, that's in their toolkit, and they have a tool for it's essentially a RACT as well, but it calls out, just like the Transcelerate one, it calls out what are your CTLs, how are you going to track them, what are your tolerance limits. And then DIA also has like a roadmap to being compliant. I found in my world, I don't know, in my everyday life, the Transcelerate RACT and their toolkit and the Citi toolkit to be really helpful.
Fantastic. Awesome. Thank you so much.
Oh, actually, and there's another aspect of that question, I think, too, awesome, which is your data is a huge tool. So there are, and one of the really interesting ways that technology is being used is to take all of our data that we're getting and put it into perhaps like a dashboard. And I think there's some issues with this. You got to be really clear about what matters and what metrics matter. So you're not just getting some, dashboard that is sort of meaningless for you. Make it super meaningful. And if you have the technology and the resources to do it, and make something automatic so you can see those those fluctuations in your data in real time, that can be hugely impactful.
Yeah, fantastic. Melissa, how do you maintain quality by design as a continuous process rather than a one-off exercise at study start?
I think this hits on kind of a huge issue, right? Because you can have a great start and that doesn't ensure a great ending. Mm-hmm. So that's why we've got to really deal with the fact that this is a shift. This is a shift in philosophy, a shift in thinking. This should impact a lot of our conversations. So you have to sort of build in quality by design to all of your processes, your quality ethos, really. And so when we're having town halls, when we're talking to our teams, we should be bringing up quality by design or some element and how it's working, what we're doing. The critical to quality factors and the key risk indicators for me are the metrics that matter for the work that we're doing. So those should be integrated into all of the dealings all the conversations that you're having around your projects, your studies.
Yeah. Fantastic. So how do you align your critical quality, your KRIs, your QTLs, so they all actually inform each other rather than just being managed in silos?
Yeah. So this can be super tricky. I would say making it visible is kind of like the easiest thing to do. Yeah. If you are, so you want that traceability. You want to have the reason I'm looking at this QTL, this quality tolerance limit, or this CRI, is because we identified this risk up front. So simply having a table that's in your, well, a lot of debate over where it could be located, but in somewhere in your documents that identifies, the critical to quality issue was, like I said earlier, maybe it's like blinding or missed visits. That's a common one. And then your KRI, your key risk indicator, is going to be how many missed visits, or maybe it's a percentage, or however you're looking at it. And then your quality tolerance limit is like how many missed visits matter to us. And that's why I'm saying also, as you go through this process, you're going to be developing what these are. I know we're starting off with the end in mind, but it becomes more and more clear the further we get along. So you're constantly also reevaluating those and bringing those back up and saying, maybe this tolerance limit is a little bit too wide, right? So bringing it in. I think you want the traceability somewhere, but it will become very apparent as if you continue to discuss it, and it's a key part of your study management meeting to go over those KRIs and just make sure that you're operating in a place that you're comfortable. So know that you haven't reached the upper limit or lower limit, and maybe we readjust those as we move forward. Hopefully that answered your question.
No, fantastic. Yes, of course it did. So Melisa, whatever you feel comfortable sharing, what examples could you share where quality by design prevented downstream quality issues or saved significant time and resources, etc.?
Yeah. So a couple of things come to mind right off the bat. First, just that simplified visit schedule. So I think this is a good one because it really highlights that the quality by design should be focused on the patient experience and the outcome of your data. So is your patient, so every time they have to visit, you're just seeing maybe a data point or a set of data points. And I think that as one thing that our industry is very good at is understanding the patient, or trying at least to understand the patient perspective and the voice of our ultimate customer, the patient. So if you can simplify that schedule, I think that proves to everyone that's a benefit, right? So I've seen something where we were able to remove some of the visits. We were able to readjust how those visits were happening. And that actually, what we saw in time was about a quarter more retention. So that's super meaningful. And that means that we are going to have to put less effort into getting more patients on that study. Another example was, I think this is one we're really struggling with, but I have seen it work, where you enforce or have more of a targeted monitoring. So you come away and step back from 100% SDV. So obviously you're going to have, the efficiency of your CRA will improve, but you're also going to remove some potential for turnover and for burnout. And I mean, from my little corner of the QA, world, from my perspective, I have gotten to the bottom of done root cause analysis on quality events and found in many times that the root cause was the CRA just does not have time to look at everything. And I think we have to come really face to face with that. And as an industry say that what we're asking for is it's not giving us the benefit that we wanted, but it's also burning out our CRAs and the people who are doing the work.
It's a hard position to be in, for sure.
Yeah.
So what advice would you then give to someone tasked with building a quality by design culture in a team that's never done it before?
Yeah. I guess the first thing I would say is to find a guide, maybe a mentor, an expert. You can bring in a consultant to work on it, but I want to just say be sure that consultant wants to look at your whole system, because these implementations are not a one size fit all. It is going to look very, very different for a big pharma company than it is for a smaller pharma company, for an independent investigator. It's going to look very, very different. So finding what it is that's the right size for you, and I think an expert can help you do that. And then gather your resources. There's so many free resources, but you might find tools that are even easier that work for you, or something that you already have in-house. And by the way, those experts can be somebody in your already part of your organization. They're just waiting for the opportunity to talk about quality by design, like me. And I'll always be talking about it. And then, I think really you've got to start every implementation with proving to your getting the buy-in from your executive leadership, for sure.
Okay. So I have only a few more questions for you, Melissa, and then we're going to open up the floor for any sort of questions our audience may have. But I did want to ask you, so what are some of the lessons that the industry still hasn't seemed to learn about RBQM adoption after more than a decade of attempts?
So I have a sense that there are some companies that get this, but one thing that is always very concerning to me is the comfortability with firefighting and the blame culture. I think we haven't. So I had a little bit of manufacturing exposure in my younger career, and what I found really is they really follow the Deming management method. They really look at removing waste, and that's like just part of the culture. For clinical, I don't know that we always think about that first. We're really just thinking, let's get the work done, and there's so much work. We are, as an industry, more likely to be working 60, 70, 80 hours, like really just people nose to the grindstone. And always, I think the other piece of that culture is saying, we don't have time. But that is really all of those are symptoms of firefighting. They're symptoms of a detection method, which is doing the work and worrying about the defects later. But really, we need to pull that in, and I think that's something that's changing. We had Q9 came out a very long time ago. Then we had E8 and now E6. We're getting the same message over and over again. So I'm super hopeful. I'm definitely an optimist.
Oh, love it! I love it. If you could give our attendees any one last piece of advice to start doing this tomorrow to make RBQM adoption stick, what would it be?
I might have said this a couple times, but I think, first of all, take a look at the processes that you have in-house right now. Just go ahead and take a look at what those are and consider, is this quality by design? Do we already have quality by design here? And try to pull in as many factors as you can and try to identify, are there some improvements that we can make? You're going to be very successful if you can embed quality by design ethos into and the prevention method ethos into all of your SOPs. That will make you successful. That will make and also if you start to turn your teams into advocates for quality by design. So go out and, number one, even as I'm talking, go and look at Transcelerate, City, DIA, look at all the resources that are out there. Ask AI. Don't listen to everything AI says, but definitely ask. It can point you in the right direction for resources, for sure.
Absolutely. Awesome. Well, before I ask you my final question, I do want to open the floor to anyone in the audience. Does anyone have anything they'd like to ask Melissa while we have her time? We still have about 22 minutes or so. Let's see. Answer. And if not, that's okay. I hope that means we've been thorough and that you have learned so much, or hopefully you just enjoyed getting to hear all about RBQM and quality by design with me and Melissa. But Melissa, I do just want to take the time to ask you one last question. We have our upcoming 6th RBQM Summit happening January 13th and 14th in Philadelphia, which I'm so excited to have you speak at. Is there anything specifically that you're most excited about bringing folks together for?
Absolutely. So I think all the questions that you've asked me, I want to ask them, being like anyone who's coming, because I just think this conversation is, we've got to be very creative with how we apply different tools. And I just am really, really curious how people are making this real and how they're really applying it to their their sized company and their specific complexity. So what does it look like? And I have, just the feedback that I already have, it looks very, very different. So I'm really interested. I'm always going to ask somebody what tools they're using, because I think that's for me. I want to know what works and what doesn't. But certainly, I'm just interested to hear how people are taking it on board, how they're digesting it for their companies, and what's working, what's not working.
I love it. Awesome. Melissa, thank you so much for your time. Folks, before you leave, I have one final question for you. If you are planning on coming to this RBQM Summit, I'd love to ask you, there should be a final question, Jackie, if you don't mind. Which topic do you want most insights on at the summit? Is there something that you have questions on that you want answers on? If so, we'd love to know them now before you leave the chat. But I just want to say thank you, everyone, for your time and being here. If there are no other questions for Melissa, this will be the end of today's webinar. But just want to say thank you and give tons of gratitude to Melissa for being here and participating. And it is always such a joy to get to speak with you. So thank you again for your time. And for those of you who joined us, I hope that you learned something, brought something tangible that you can take back to your teams, or maybe just got a break. But we're just so glad that you were here to join us. So thank you all for being here.
Thanks, Sarah. Thanks, everybody.